Hi there, this is Dr. Jack Belitz, and welcome to the Ask Dr. Jack Show. We are here to answer the questions that you ask. However, today we are in the second part of a series of 3 where we've kind of deviated from that a little bit. I was reading this article on the internet. It was actually on AOL, I think. And it was talking about all these dangerous drugs and their side effects. And I'm thinking to myself, oh my gosh, if people knew there are alternatives to these things, would they really be exposing themselves to all these dangers? And that's when I decided to make this a part of the Ask Dr. Jack show. So what I did was I took that article, split it up into 3 pieces, and I'm presenting them to you as we go here. Go back and look at the archives and you will see last week's video. And we're going to talk about 2 different disorders today. The first one is going to be on sleep disorders. So before we get started, let me give you the disclaimer. I'm not a medical doctor. I'm a chiropractor sitting here in Omaha, Nebraska. I'm not trying to give anybody medical advice on drugs or anything at all. All I'm doing is simply providing you information that you could just as easily go to the internet and find any of these side effects on any number of websites out there, and I'm giving you some alternatives to them. So keep that in mind. Let's get started. First order of the day, sleep disorders. Okay, now it sucks when you're sitting there in bed, head on the pillow, and you just can't fall asleep. I get it. And if this happens over and over and over, I can imagine you might be looking at anything. So you're sitting at home on TV and there's this ad, like there's so many of them now, for Ambien, and it says you go right to sleep. I'd be possibly interested in looking into that too, because oh my gosh, it sucks not to sleep. However, experience severe drowsiness, lightheadedness, and lesser side effects include stuffy nose, muscle pains, constipation. Now, here's the thing. You need to let your doctor know every other drug that you're on, because a combination of this drug with certain other drugs could slow your breathing so much that it could be life-threatening. Really, who wants to be associated with that type of thing? Not to mention the fact that this can be addictive potentially to you. So first, that's the first one. Now, let's say you get to sleep, but you can't stay asleep. Now, here's a drug called Halcyon. But imagine going through your day having no recollection of anything you did. Crazy, right? Ambien will help you fall asleep. Medications like Halcyon stay asleep. However, if you look at any of these websites, you're going to have the possible side effects of vision problems, jaundice, fast or pounding heart rate, and some of these people driven cars, talked on the phone, eaten meals, and have no recollection of these activities whatsoever. So kind of scary. In fact, they say if you have this, so it must not be an uncommon effect, they mention this, if you have this, you should be talking to your doctor immediately. Well, how about let's just not even get into it and not even worry about it. Okay, so what do you do if you have one of these sleep disorders and you don't want to do a prescription drug? Well, we offer some really advanced methods of chiropractic here, which really play with how much information and what force that information is being brought up to the higher cortical centers of the brain. Not only that, but we've been doing a lot of studies lately at different seminars, and we've got some great lab tests that we can run, and we can actually help balance out the neurotransmitters that are going on in the brain to help you sleep better, longer, and easier. All of this without doing prescription drugs. So if you have this or your relatives have this, whatever, let them know that there's alternatives out there. Send them this. If you mention this video when you call the office, we'll do the exam at no charge whatsoever. We just want to get people off some of these drugs if we can. Second thing, we're going to talk about high blood pressure now. Major drug in the market right now is called Vasotec, used for treating high blood pressure. But It can lower your blood pressure, so you might start to feel like you're going to pass out. It's also possible to have fast or uneven heartbeats, jaundice, swelling, rapid weight gain, and also undesirable issues like insomnia or nausea. So yeah, imagine taking this stuff and then having to go right back to the Ambien because you can't get to sleep. All right. Now, Cardura, not sure exactly how to pronounce it. This medication also treats high blood pressure, but it's also used for men with prostate issues. However, it's very commonly associated with drowsiness, dizziness, low blood pressure. It's possible for Cardura for irregular heartbeats, breathing problems, and even painful erections that can last for hours. So, you know, again, if you don't need it, why take it? Blood pressure is another huge area in which we're doing some amazing things in this office. One of the ways that we can do it is by getting the nerves that are going to the heart and lungs and other various organs to work correctly. So maybe your brain's trying to send the correct signals down to these organs, but they're getting screwed up by the time they get there. So we do some computerized exams, we find some problems in that area, we get the nerves to relax a little bit, get some of that pressure off, blood pressure goes down. Huge, strong studies have shown that chiropractic has great effects on blood pressure. But also, we are finding out that blood pressure is very affected by the things in which we eat. Medical doctors have known about this for years. In fact, years ago, they would look at your diet and give you advice on it. Now they just hand out pills. So in this office, what we're going to do is we're going to look at your diet. We're going to try to educate you on the latest studies and showing you the different foods that are giving problems like that. So, in short, call the office and give us a call, give us a chance to help you out. It's way better than taking some of these drugs. Our phone number, 402-333-4848. You can use that for an appointment or to give us suggestions for our Ask Dr. Jack show. Or you can email us at AskDrJackB, that's BEE @gmail.com, or walk into the office and let me know yourself. I hope you have a very happy and healthy day, and I can't wait to see you next week when we do part 3 of our series of 3 hazardous drugs and their healthy alternatives. Have a beautiful day.